Hello students, today we are going to learn about the microwave diathermy. Okay, microwave diathermy. It is commonly abbreviated as MWD. Okay, so MWD it is universal short form for microwave diathermy. In this lecture, there will be frequent comparison of shortwave diathermy and microwave diathermy. So I request you that if you have not seen the video of shortwave diathermy, you see the video of shortwave diathermy first, then you see this video of microwave diathermy. Okay, so let us start in detail regarding this microwave diathermy. So coming to the introduction part, so what is microwave diathermy? So it is defined as the use of microwaves for various therapeutic purposes. So here we are using microwaves for therapy purpose. You all know that microwaves, they are also used for cooking purpose. We all are familiar with the microwave oven. So this microwave oven will be also responsible for production of heating. Here microwave diathermy, it is also responsible for production of heating. But here our discussion will be limited to therapeutic purpose only. This microwave has higher frequency and shorter wavelength as compared to shortwave diathermy. So here the comparison has started between the shortwave diathermy and microwave diathermy. So again, you see the video of shortwave diathermy, okay, then you see this video of microwave diathermy. So in short, microwave diathermy, it is having higher frequency and shorter wavelength as compared to shortwave diathermy. What are these frequencies and wavelengths? So frequency range is 300 megahertz to 300 gigahertz, and wavelength is from 1 centimeter to 1 meter. I repeat, frequency is 300 megahertz to 300 gigahertz, and wavelength is 1 centimeter to 1 meter. Now these are the ranges. Now what should be the dedicated frequency that is used for medical purposes? Okay, so here for medical purpose we have three dedicated frequencies. So frequencies are 2456, 915 and 433.92 megahertz with their wavelengths of 12.24, 32.79 and 69 centimeter. Clear? So you can see that as this frequency is decreasing, wavelength is increasing. Okay, so the multiplication of wavelength and frequency will be always constant. So now this use of microwave diathermy, how it is useful? Clear? So it can directly penetrate into the tissue to some extent. So we can say that many times up to 3 centimeter it is going deeper into the tissue, and inside the tissue it will be producing heat like shortwave diathermy. Clear? And it will be good absorbed by water and high vascular tissues. So best example is muscle. So the muscle will be best treated by this microwave diathermy. Why? Because the fluid content inside the muscle, that is nothing but blood, will be absorbing this microwaves, and definitely it will be converted into heat. Now let us see for the production of this microwave diathermy. So you just have a look on this diagram. This is schematic diagram. So as you can see in this figure, the mains is there. So this machine, it is connected with alternating current supply. So generally we are connecting with our socket that is already present inside our clinic. So this socket will be providing alternating current with 50 hertz of frequency, and voltage is 220 volts. Clear? So this is nothing but power supply to machine. Now what this power supply will do? So there will be specialized type of the thermionic valve that will be present. Clear? So that is known as magnetron. This magnetron will be responsible for producing high frequency current, because whatever the frequency we are supplying from the socket of our clinic, that is in 50 hertz amount only. Okay, it is just 50 hertz. From this 50 hertz we are going up to 300 megahertz to 300 gigahertz. Okay, so we need one specialized thermionic valve, so that is known as magnetron. Okay, it is known as magnetron. What is this magnetron? So magnetron, it is nothing but one type of the triode. Okay, so in the center it will be having cathode, okay, and in the surroundings it will be having anode. So we can say that it is PNP type of valve. Okay, PNP type of triode. Okay, so P means positive, N means negative, P means again positive. Okay, one more thing that you need to see, that there will be installment of the fan and cathode heater control circuits to regulate the temperature of circuit. Now, one coaxial cable will be there, so that will carry this high frequency current from this magnetron towards emitter. Now, this high frequency current is passed to the antenna of emitter. So you can see the antenna in this figure. So what is antenna? So antenna is mounted in front of metal reflector. Now what is reflector? So reflector is a metal plate which directs the microwave in only one direction. Now whatever the microwaves they are coming, they will be traveling in all the direction. But the design of the reflector will be such that all this extra microwaves, those are not going into the direction of patient, they will be reflected back and will be given direction towards patient only. So what we can say, the reflector will direct all these microwaves in one direction only. Which direction? So that is towards emitter's direction, and emitter will be facing patient. Now what is emitter? So when you combine this antenna and reflector, it will be known as emitter. So you can see emitter means the function of the emitter is to emit microwaves. Okay, so this is known as emitter, means it is output of microwaves. Okay, so this emitter, it is also known as director or applicator. So on different places different names will be used, either emitter or director or applicator, but otherwise all they are same. The function of emitter or director or applicator is to emit microwaves, okay, towards patient. Now this emitters, they are of various size and shapes. So it is based on different companies, they are producing different size and different shapes. Clear? But as you can see in the diagram, there are two main types or basic types. So they are circular and rectangular. So figure A, you can see it is circular type of this emitter, and figure B, it is rectangular type of emitter. Now let us understand what is the difference between this circular emitter and rectangular emitter in terms of clinical implication. So in case of circular emitter, so the name itself, it is telling that it produces microwaves which are in circular in cross section. So it will be having more density of this microwaves in periphery as compared to center. So we can say that whenever this type of the microwaves they are given to the patient, so over the peripheral area of this circle, patient will be feeling more heat as compared to central area. Now what about this rectangular emitter? So they will produce the microwave which are oval in shape at cross sectional part, okay, and they will be denser at the center as compared to at periphery. So as you can see in this figure B, so the center part of this oval shape will be heated more, okay, as compared to peripheral part. Now what about the placement? So the distance between the emitter and skin should be 10 to 20 centimeter. Now this is just one range, okay. Now it depends on many factors, so distance may be less also, maybe more also. So which are these factors? So this distance may vary according to the size of emitter, part to be treated, and the condition of patient. Okay, so based on this you have to decide the distance, but on an average it will be 10 to 20 centimeter. Now this distance will be dependent on smaller area as well as larger area also. So if you want to treat small area, so definitely the distance should be less, so that your spreading of this microwaves will be limited, so that is between 2 to 5 centimeter. In case of larger area, definitely you want to cover larger area, so you need the spreading of this microwaves from emitter, so distance should be also more, so that is 10 to 15 centimeter. Okay, so it is logical thing that if you want to treat smaller area, so just you want to restrict the spreading of this microwaves, so the distance should be less. In case of larger area you want to treat, so definitely you need spreading of this microwaves over the larger area, so distance should be kept more. Now what about this physiological effects and therapeutic uses of microwave diathermy? So they are most of physiological and therapeutic effects same as compared to shortwave diathermy. Clear? So here again the comparison has come. So therapeutic uses, okay, they will be same like whatever we are doing for shortwave diathermy. Then what is the difference between the shortwave diathermy and microwave diathermy? So the amount of heat production is more in muscles as compared to shortwave diathermy. So we can say that if we want to treat the muscle, so the microwave diathermy will be better option as compared to shortwave diathermy. Okay, this is as per understanding. But if you find out the research, so the research they are not providing any definite evidence that microwave diathermy it is more useful or better as compared to shortwave diathermy, but clinically it is the observation of many clinicians that this production of heat will be more in muscle by microwave diathermy as compared to shortwave diathermy. So this microwave diathermy should be preferred over shortwave diathermy, especially for muscular pain. Now, this microwave diathermy it is more useful in local condition as compared to generalized condition. And heat production by this microwave diathermy it depends on watery content of tissue. So the tissue that is having good blood supply will be heated more and will be getting more benefit by this microwave diathermy. Now the depth of penetration, so previously also in this lecture only I told that it may be up to 3 centimeter. Now depending on the tissue to be treated, it may range from 3 mm to 3 centimeter, but maximum it is 3 centimeter. In shortwave diathermy it is throughout heating. Like if you have two plates, on one on medial side and one on lateral side of the knee joint, so waves they will pass throughout the knee joint in case of shortwave diathermy. But in case of microwave diathermy, they can penetrate only up to 3 centimeter. So for much deeper tissue, this microwave diathermy will not be useful or will not be giving good result. What are the uses? So that can be used in traumatic condition. So after any trauma there will be pain, inflammation. So to subside this inflammation, this microwave diathermy will be beneficial. But again for acute conditions, that is from up to 2-3 days after injury, no heating therapy is advisable. We should always rely on cryotherapy. But after that, in case of subacute or chronic condition, we can think of this heating therapy. Okay, and in this various heating modalities we can also give preference to microwave diathermy. Clear? Okay, other inflammatory conditions, so that is nothing but joint arthritis or any muscle inflammation. Okay, there are degenerative arthropathies. Degenerative means it is age related pain. Okay, then in case of enthesopathies means wherever you have attachment of ligament or this tendon over the bone, so that area will be giving you pain, that is suffering from any pathology. Clear? So pain and inflammation over the attachment of tendon or ligament to bone, okay, that will be known as enthesopathy. Okay, arthritis, that is nothing but inflammation of joints and other soft tissue pathology. So that is nothing but pathology related to soft tissues like muscle, ligament, okay, joint capsules. Okay, so in this pathologies also microwave diathermy will be useful, as well as few superficial joints pathology. So here whenever your joints or bones or muscles, tendons, ligaments, they are having inflammation or one sign of the inflammation, that is pain, so this microwave diathermy will be useful. This microwave diathermy will be more useful in case of superficial tissues, those which are having high fluid content. So that is nothing but muscle. Clear? Now the dosage, that will depend on acute or chronic condition. For acute condition, the dosage should be 5 to 10 minutes, and for chronic condition it should be ranging from 50 to 30 minutes. Now this also depends on condition of patient, because many times patients they are not capable enough to maintain particular positions for 15 to 30 minutes. So in that case you will have to modify. Clear? So it depends on condition of patient, and it is also dependent on type of applicator used, because few applicators they are concentrating more heat over the particular localized area. So you need to reduce the treatment time, because otherwise what will happen, prolonged exposure to this higher intensity may lead to burns also. So here we have to be wise. We have to see the patient's condition, whether it is acute or chronic. whether the patient is having good general condition to tolerate this microwave diathermy or not, and which type of the applicator or emitter is used. Now, what should be the amount of heat that should be felt by patient? So it should be comfortable warmth. Okay, how much? So for example, if you are blowing from your mouth on your dorsum of the hand, so what amount of the heat you are feeling on your dorsum of the hand, the same amount of heat should be felt by patient whenever the patient is given microwave diathermy, because many patients they are having this type of the belief that if I am feeling more heat I will be cured earlier, but that is not true. Okay, it should be just comfortable warmth, that's it. Now power output, so we will be having intensity knob whenever we are giving this microwave diathermy to the patient, so we can reach up to 200 watts, clear. So by giving this 200 watts we are raising the body temperature up to the 40 to 45 degrees Celsius. More than that it is not advisable, clear, because our normal body temperature is 37 degrees Celsius, so maximally we can reach up to 44 or 45 degrees Celsius. If this temperature increases more than 44 or 45 degrees Celsius, there are chances of skin burns. Now, treatment may be given daily, may be given on alternate day also. So it depends on severity of patients. Now there are few dangers and contraindications we are covering under single title. So first of all we need to take care of the burns. So we all know that whenever this hitting modality is given, so maybe patient is getting more intensity. Okay, because in microwave diathermy also the amount of intensity will be decided by patient only. As a therapist we are setting on 200 watts, okay, that is fine, but if the patient tells that I am feeling more heat, definitely we should reduce the intensity. Many times patient is not reporting overheating just because of impaired sensation. So in that case also, before giving this microwave diathermy we should check the sensation of patient, and if we find that sensations are impaired, then definitely we should take care of this intensity. We should not give more intensity even if the patient requests, clear. Now second is metal in the tissue. So if the metal in the tissue is there, so it can concentrate this heating, and the surrounding area of this metal that may get damaged. Okay, so metal is nothing but it is nails, screw, plate after the fracture stabilization, whatever they are implanted into the patient's body. So before we give this microwave diathermy we should ask the history, and in that history we should always ask that you have any internal fixation into your body. If it is there we can give, but with precaution. In case of shortwave diathermy, definitely the damage will be more because it is based on electric field. Here we can give but with precaution, so it is one type of the relative contraindication. Damage to hearing aid and pacemaker. So when the patient is having hearing aid, so because of the frequency of microwave diathermy, so function of hearing aid may be disturbed. And in case of pacemaker, we know that pacemaker it is one type of the artificial type of the heartbeat generator, so we can say that it is artificial SA node, clear. So definitely the microwave diathermy may disturb the rhythm of this pacemaker. Okay, so the patient may be having problem and this may be life threatening, so it is advisable to avoid this type of the patients of pacemaker. Okay, and especially whenever you want to treat that patient in the surrounding area of pacemaker like shoulder or neck. Eyes may be having damage, okay, because there will be excessive heating in the intraocular fluid, so eyes should be always covered whenever the treatment is given with microwave diathermy. Now circulatory effect. So this microwave diathermy also by heating it will be increasing vaso dilatation, so definitely the more blood supply will be there. Okay, so this vasodilatation or increased blood supply will be the only mechanism, so that will reduce your inflammation, that will uh, uh, increase more oxygen, that will increase that will supply more nutrition, that will supply antibodies, okay, that will supply amino acid. But here the arteries must be capable of doing all these things, okay, because as the vasodilatation occurs there will be increased blood supply. So if the arteries, they are not capable of this increased blood supply to manage, so definitely there are chances of bleeding. So in case of circulatory problems, you must take care, especially whenever the patient is having venous thrombosis or thrombophlebitis. So in case of this too also, there may be dislodgement of this thrombus, and that thrombus may go to systemic circulation and may block any artery. So in case of any vascular disease, it is advisable not to give this microwave diathermy. In case of menstruation also, already there is bleeding, so it is advisable to avoid microwave diathermy to pelvis region or back region. In case of pregnancy also, it is advisable to avoid use of microwave diathermy over the pelvis region or back region. In case of tumor, so there will be uncontrolled cell division. So we know that because of heating, as per Van Hoff's law, so if the heating is more, it will increase the chemical reaction. So here it will increase the metabolism. So if the metabolism is increased, so definitely there will be more amount of oxygen that will be required. Okay, and it will also accelerate the growth of tumor. Clear? So tumor growth will be accelerated, okay, because cell control division will be accelerated. Clear? Why? Because of heating, okay, as per Van Hoff's law. As well as the oxygen demand will also increase. So in case of tumor, it is advisable not to give microwave diathermy. In case of deep X-ray or cobalt therapy, definitely after this therapy there will be devitalization of the tissue. So it is advisable to avoid microwave diathermy, because this devitalized tissue may not be able to tolerate microwave diathermy and it may have adverse effects. Now, if the patient has just gone for X-ray for any diagnosis purpose, like one time or two times, so it is not contraindication, okay, that is routine. But we are talking of deep X-ray therapy, so that is nothing but therapy for cancer it is given. So now last is patients at particular risk. So in case of microwave diathermy also, the patient's feedback regarding intensity is very important, because if the patients, they are not telling us that what should be the frequency, we will not be able to judge properly. Clear? Because each and every patient's perceptions will be different. Clear? So definitely the patient should be cooperative, and patient, if the patient is child, or if the patient is mentally retarded, if the patient is unconscious, if the patient is epileptic, so all these patients, they are not properly informing us regarding the intensity requirement. Clear? So we are setting 200 watts, but it may be too much for someone, or it may be less also for someone. So it depends on individual perception. Clear? So the patients, those are not able to give us feedback regarding the intensity feeling, they should be avoided for this microwave diathermy treatment. Now before we complete this lecture, you will see that the use of this microwave diathermy is limited in different clinical settings. That is because of cost of this machine. Clear? So as compared to shortwave diathermy, microwave diathermy will be more than 8 to 10 times higher cost. So most of the clinical settings, they are not purchasing this, because we have to see budget or funding also. So you will see this very less, but if you have this microwave diathermy at your clinic, it gives very good results. And this picture, that is of this textbook, that is textbook of electrotherapy and Jagmohan Singh. So as a reference, I have prepared this lecture from this book. So I am thankful to this author of book, Jagmohan Singh. If you have any question, you can ask. Thank you.